Dear friends, welcome back to my channel Alpha Physio Pelvic Care, all things pelvic health and beyond. My name is Anastasia Ovarova and I'm practicing pelvic floor physiotherapist here in a very hot and sunny Cyprus, as well as online. Today I will be talking about very mysterious condition that so many women are diagnosed with, but there is such a scattered approach on how to treat it. There is still no consensus on how to treat it because the condition can be quite complex. And today I will talk about vulvodynia. Vulvodynia is pain that can affect any area around vulva. It can be around the actual vulva, it can be on the side, it can be around the anus, it can be around the clitoris, it can refer inside. And this pain is something that is very specific. Most women describe it as burning, intense burning sensation. It can be also a combination of itching and burning. It can be stabbing pain. Sometimes it can be sharp. Most of the time it will be there all the time. And the difference between other conditions, such as for example vaginismus, when the pain only occurs on the penetration, vulvodynia can be there for 24/7. Sometimes it's less, sometimes it's more. Sometimes it might have triggers and sometimes it don't. And this is why it can be so complex to approach, because every woman will have a different pattern of the pain. Before we start, if you do enjoy my videos, I would greatly appreciate if you press that subscribe button and like button on this video if you enjoyed it. Feel free to write your comments, ask me a question. I will be more than happy to answer it. So that I'm not gonna open here a book and read you a definition on what is vulvodynia, what are the signs and symptoms, how is it treated, because, well, you can all Google it or ask ChatGPT or whatever. But over the years, I have collected enough data, and I've been practicing pelvic floor physiotherapy for over 10 years now, to clearly see a pattern on how vulvodynia starts, what makes it worse, and what should be approach on managing this condition, treating this condition, and with what mindset it is easier to manage and approach this condition, because it's not only about the physical component and that's it. First, let me say that vulvodynia is something that the patient feels, but most of the time no one else can see or test. So if I do an assessment, or a gynecologist will do an assessment of patient vulvodynia, their vulva, their vaginal tissues, the outside of the vagina and anything else, most of the time will look normal. There might be some irritation, but again, most of the time it occurs because of some kind of mechanical irritation, so most of the time itching. Often these patients will undergo major tests. They will be checked with swabs, and everything will come clear, and they might experience similar symptoms to UTI. But let's try to put it in the compartments, because it's a vast topic and I will try to make it as easier as possible for you. We will have a look at what are the common triggers I see in my practice for vulvodynia, what are the treatment approaches and what to expect, what mindset you should have when treating, when approaching vulvodynia, and when managing. How vulvodynia starts. There are certain patterns that I have seen in my clinic again and again and again, and these are major stress events. I have seen countless amounts of time from younger women. I went to study abroad. It was very stressful for me. I had thrush infections and it started. Or I had no thrush infections and it started. So there usually is a major event that starts and becomes a trigger, major stressful event. It can be related to interpersonal relationship, it can be unwanted sexual intercourse, it can be rape, but sometimes it's a non-sexual related stress. It can be death of someone, it can be starting a new job in a new country, it can be anything that can trigger these events. Usually these people are already suffering from some sort of anxiety or stress. So their nervous system is already more susceptible to stress than other people. And this is their physiology quite often. There is another vicious cycle that I see very, very often with vulvodynia. And it starts with one yeast infection. Very often, these are also confused with UTIs and treated with antibiotics. So there is yeast, it's treated with antibiotics for unknown reason. It's treated with different yeast protocols, and then kind of gets better and then gets worse, and again. So woman can have 2, 3, 5 every month after every period yeast infection, and every time, of course, she will be in so much discomfort, she will want to treat it. At some point, there is a trigger that goes off, and she starts to have that burning sensation, that persistent burning sensation that is not anymore that itch of the yeast. It's there just most of the time. It can be there 24/7, and there are very little relief, and yeast treatment doesn't work anymore. Another is classic one, UTI, and it might start with actual UTI. Woman will get UTI once, twice, 3, 5 times. Of course, she will take rounds of antibiotics. Every time it might be different, more stronger antibiotic. And again, the antibiotic use, for some reason, triggers that nerve sensitivity. Three really central causes that I've seen in my clinic. Of course, there can be other different causes. These are not exclusives, but these stories I hear again and again and again. Before we jump to the management, I would like to talk about the fact that vulvodynia is not something that is an injury. We let it heal and it's fine, it's gone. It's a neural sensitization. The nerves around the vulva become so sensitive that they perceive only and fire only painful burning signals. These signals travel through your spinal cord into your brain, and there is a certain areas of the brain that perceive this pain. This is normal. This is what happens with any part of our body, including our genitals. So both parties, let's say, are getting sensitized. The local nerves, the branches of pudendal nerve that supply the area around the vulva, they're getting overly sensitized. They constantly start to fire these signals, and the area that's perceived the pain in the brain is also constantly getting overstimulated with these signals. It also gets sensitized. However, the area that perceives the pain from our genital organs is not the only one. There are other areas as well, other inputs. So this is where we're gonna talk later on how important is the stress management, and management not only locally around the vulva, which is probably just symptomatic relief, but also to calm down, to relax, to desensitize the nerve system. This is also very important, both local and the central one. Let's talk about the management and the treatment. I'm a pelvic floor physiotherapist, so I could go on and on about pelvic floor physiotherapy for vulvodynia. But the fact is that when client comes to me with vulvodynia, there is very little actual pelvic floor physiotherapy happening, at least in the beginning, and at least hands-on. We start with general lifestyle. We start with things that is important to address, because there is a certain protocol with the treatment of the neural pain. However, we really have to look at the person and what they experience to start to do some kind of management strategy. It is important to understand that treatment and management of vulvodynia will not be only down to one single approach. It will not only be pills, it will not only be breathing exercises, it will not only be pelvic floor exercises, it will not only be massages, it will be a lot more. It will be also your diet, it will be also your sleep pattern. So first thing I start is with the basic. How is your sleep? Do you sleep enough? If you do not sleep enough, then you will be in more pain. I am not in the position to discuss with the client any type of therapy that can aid their sleep, because quite often they are in a circle of pain, poor sleep, pain, poor sleep. They're woken up by pain, therefore they don't sleep, therefore they feel more pain, because Nervous system does not have time to rest, does not have time to recover. Pure cell exchange and recovery cannot happen. So I always ask my clients to discuss with the relevant healthcare professional, if it's a doctor, a GP, a sleep therapist, a pain management doctor, because I'm a non-prescribing practitioner. I do not prescribe medication, to discuss sleep strategy. Maybe it's just a bit of melatonin that can help them. If they need to take a painkiller to calm things down and be able to sleep, painkiller it is. If they need to have some sleeping therapy, sleeping pills to make them to sleep and rest better, they might need to take it. Sleep must be addressed first and foremost. Without sleep, with a poor sleep, the outcomes will be poorer. It will be harder to manage the condition because you'll be so tired. It will also affect your psychology. Therefore, sleep, I would say, is number one. Number two, we look at any mechanical influences. And mechanical influences is all your underwear and the clothing you're wearing. Underwear, I usually say, pure cotton, wider possible, extra size up, nothing pressing, nothing rubbing around your vulva, the looser the possible. For women, it quite often means wearing a lot of skirts or really baggy, loose trousers. Speaking about the skirts and trousers, again, I also don't look only at how loose they are here, but importantly, what's happening around the waist. Somebody can come to me with a skirt or with a baggy trouser, but they will be tight around the waist. So the pressure around the abdominal will create compression and downwards pressure on the pelvic floor, which can exacerbate the pain around the vulva. So everything and everywhere should be nice and loose. We also look at the hygiene products they use. Most of the time, these women will use only pads. They can't put anything inside, such as cup and tampon, so it's only pads. We always look at the most organic, the most pure options possible. No bleach products. So again, sometimes it can be trial and error, but I always propose a couple of brands to try and see what works best. Number three, I talk about pattern, what makes things worse, what makes things better. We want those things that makes things better more, those things that makes things worse less. And therefore it is important to start a trigger diary, pattern diary, when you are more in pain, when things are worse. Is it when you're in period? Is it after toilet? Is it after exercises? I see a lot of women getting way worse after exercises, even pelvic floor exercises. And this is one of the cases I would sometimes say, right now, we're not doing any pelvic floor exercises, any Kegels. The only thing we're doing, we're breathing, we are relaxing. Sometimes just that in a different position, or sometimes in the only position that it makes it less painful. So it is very important to catch that anchor, as I might call it, the less painful, and build around it. What makes your pain better? Is it a cold pack? Then put a cold pack, put a knicker, put a cold pack, put another knicker, sit and breathe. If it's a shower, get into the shower, put some water, and then breathe after that. And these people are quite often distressed. So just side breathing here, sometimes even that can cause them pain and trigger them, because body is already in a protective mode and tight mode. So even with the breathing, we try to find the ways that makes it less traumatic and less triggering. I am very for medical therapy if necessary. I know that many people don't like to take any pills, painkillers, and so on, maybe local injections, but sometimes we need to have a look at ways to break the vicious circle. If we do need to go a little bit more heavy, short term, on medication, again, discuss with appropriate healthcare professional. I'm not prescribing one, but I always imply that this needs to be discussed. If we do need to go a little bit more heavier on the painkillers in order to progress in the therapy, in order to make you be able to breathe maybe to go for your walk, or maybe just to do things you want to do, to sleep better, to rest, to eat better, to focus on your food instead of pain, we are using medical therapy. In no case I will demonize medical therapy if it's necessary. I'm not a fan of popping pills, but if it's needed, it's needed. Caution with desensitization. Desensitization is a very fancy word, especially in the physiotherapy world, when basically you expose the area of pain to different stimuli, and it supposedly reduces the sensitivity towards those stimuli. With the vulvodynia, it can be just even pouring water, or just putting cream and rubbing the area, or maybe using vaginal dilators. And quite often I see DIY desensitization. I'm very pro desensitization, such a long word, but it has to be done carefully. It has to be done with a certain purpose, not just because to do it. And quite often we will start with definitely hands-off desensitization. I would ask women to maybe massage just their abdomen, or just place their hands and breathe, or just to do some pelvic rotations, and it's already a certain mechanical input on the painful area. We can start really far and then go closer. With some women, vibration and vibrator will be very appropriate. They will be ready for it and they will be doing it. For some women, just touching the area with vibrator would trigger them off for days and days on. So this is very individual. Just to be cautious on desensitization, it has its time and it has its place. This is the big part. What to expect? The question. Will I get better? Will I get better? This is the question I get asked 5 times within one therapy by somebody who is suffering from vulvodynia. I have not suffered from vulvodynia, but I have suffered some chronic pain in my life that I thought that this is it. This is it. This is how I'm going to be. This is how I'm going to function. It is very hard, especially when you do not have visible symptoms. You do not have symptoms that you can quantify. You do not have symptoms that you can test. Just you have to tell about your symptoms to someone in the hope that this someone will believe you. And if they don't, it's very debilitating. It's very hard on the patient. My answer is something that I'm not supposed to say as a pelvic floor physiotherapist. I don't know. However, we can try our best to make things better. It will take you time. By time I mean, it can be months, it can be some year. Nervous system is such thing that it does not recover as fast as the muscle do. As the broken bone, 6 weeks, usually it's healed, 8 weeks maximum if it's a really big bone. Nervous system to reset, it takes a lot of time. So good sleep patterns, proper desensitization patterns, good eating patterns, whatever patterns you choose, they have to be long-term. They have to become your lifestyle. In 1 week of good sleep, things might not suddenly drastically change 180 degrees. No, it has to be something long. As you have understand, it's a multifactorial approach. People will try different things from traditional medicine, alternative medicine, and there will be something, I promise you, there will be something that will help you and make things better. For some of my clients it was cold, for some it was CBD, for somebody it was meditation, for somebody it was that certain medication, that certain pill that worked for them. For somebody it was Botox, for somebody it was something else. It is a search, but it's something that you will eventually find that can help you. Another thing, important thing, is pacing. Quite often the vulvodynia, if it gets slightly better, it can get slightly worse, and a patient perceives it as, oh my God, I'm failing here with my therapy. I've been doing so well, things were going fine for 3, 4, 5 days, and now I'm back to square one. It is not like that. When we talk about some type of subchronic or chronic pain, It's usually the curve that goes up and down, and then slowly it smooths out. So you will go back sometimes, you will have triggers sometimes. It doesn't mean that you're doing damage. It does not mean that you're doing damage to those tissues. It does not mean that things are going worse, because they will get better again as soon as you're persistent with your management strategies. Another thing is, which I totally understand that it's very, very hard, is to focus also on something else. People with chronic pain, especially when it's in your genitalia between your legs, when you're sitting maybe for many days, or on the contrary standing, when you cannot have normal intercourse with your partner because it's hurt so much, they understandably, absolutely understandably so, become fixated on that pain. However, it is important to set out of that pain goals. So think about what would you like to achieve. And I'm not talking now about getting your PhD or any major goals. If you're in so much pain, maybe it's to read a book, to finish a book, or maybe to listen to a book, audiobook, if it's harder to concentrate on a reading material. Maybe it's to get your 5 steps a day, 5K steps a day, let's say. And if you know that it's not a major provocative factor, you're getting it in and you're working towards your goal of fitness, let's say. It's getting more protein in your food. It's getting 5-minute meditation and mindfulness every day. So set yourself other goals, that at least one small goal that is not related, because you are not defined by your condition. It does feel like it when you get the diagnosis in the beginning and when you try to treat it, but slowly you really realize that you are not defined by your condition. You have it, you'll manage it, and you're going to take the upper hand over it, and not vice versa. When you suffer from vulvodynia, it's a difficult condition. However, there are things that you can make to make it better. It might go completely. It might come back, come and go. This pattern can happen as well. It doesn't mean that damage is happening. But I promise that you will become an expert on your body, and you will find things that work better for you, that work great for you. And then you can then start layering on those things and get your life back. If you enjoyed this video, if you have any questions you would like to ask me, or any comments or sharing your experiences, I will be more happy if you pop them in the comments. Thank you guys so much for watching, and we will see you back very, very soon. Bye bye.